Hi, my name is Dr. Vidyadhar Watve. I am a consultant psychiatrist in a hospital, namely Poona Hospital and Research Center in Navi, Peth. I am in practice for last 46 years. My main interest is biological psychiatry. That means I view all these diseases as a result of chemical changes in the brain. So, I have treated them with medication mainly, but no doubt I do take help of psychotherapy, cognitive behavior therapy, and other modalities in psychiatry, for which I have got a team of about 12 doctors, out of which 5 are psychiatrists. There is one psychologist, there is one doctorate who has done in psychology. We have got a neuropsychologist working with us, and we also have psychiatric social worker. So, my OPD timings are Monday, Thursday, 10 to 1. However, I see patient almost every day. I have never taken a leave even during my corona period. I got my graduation and post-graduation both from BJ Medical College and Sassoon General Hospital, Pune, where I was lucky to have a teacher like Dr. Shirvaikar, Dr. Mrs. Master, and many of the senior psychiatrists who are known all over the country. I was also lucky to be a president of the Indian Psychiatric Society, Pune, president of the Indian Psychiatric Society, All India Indian Psychiatric Society, which is the main body of the psychiatrists working in India. We also have psychologists as the members of this society. I was also a president of the West Zone Psychiatric Society. I was also president of the Poona Psychiatric Society, and Indian Psychiatric Society is the main body for which I headed for 2 years, 15 and 16. I am also a member of American Psychiatric Association. I travel all over the world with a group, theatre group called Ghashirampur Kotwal, of which I was important member. I had a lot of interest in theatre, so I've seen the world, most of the world, with the play called Ghashiram Kotwal. Then other things which I do is taking part in conferences. I have present in number of conferences, and my presentations are based on biological psychiatry mainly. I have done it in conferences in India as well as abroad. So I have seen almost most of the world with the help of psychiatry as well as theatre in the previous years. But now last 20, 25, 30 years now, after 1994, I have almost left theatre activity and completely engaged into psychiatric activity. I am really lucky to have a team members consisting of psychiatrists, psychologists, and psychiatric social worker. I have got a separate department of psychiatry in Pune Hospital. I am lucky to have a place like this, and which is given to me almost free of cost, and I am working there 12 hours a day. I am also lucky to have my wife, who is Dr. Mrs. Sujala Watve. She is a doctorate in psychology, and her main interest in child and intelligent people and problems with Mensa trained higher intelligence people, because she was director in Jnana Prabodhini Institute of Education. Now she has retired from there. I am also likely to retire, but I can't never give up psychiatry, and I am just obsessed with that. So with this, I conclude my own introduction. All the best. Happy New Year.